name's Sallie Alcorn. I am your at-large 5 city council member, and welcome to the first day of fall. Can you believe it? We're finally here. And the first day of fall for Bill Case and me means Falls Prevention Awareness. I want to thank all of you for tuning in to our Falls Prevention Awareness virtual program. I'm joined today by my dear friend, Bill Case. Bill Case is a well-known physical therapist in Houston, Texas, and he's also written a book called Stand Tall, Don't Fall, Improve Your Strength, Balance, Flexibility, and Posture. Bill, go ahead and introduce yourself.
Thanks, Sallie. Hi, I'm Bill Case, and I've been practicing physical therapy for over 35 years. I started off in sports medicine and treating a variety of sports injuries, and over the years have developed a passion for preventing falls in the older adult, which we now know are preventable. I have lectured and written a book on this topic and believe education is the key to preventing falls.
Thank you. Tell me a little bit more about how you developed this passion.
Sure, Sallie. My dad, who is also a physical therapist for over 60 years, passed away last year at the age of 93. Following a 3-year recovery from a fall and fracturing his hip. Since then, it's become my goal to keep all older adults active, independent, and moving. My dad always used to tell me that the fountain of youth is to keep moving.
That's excellent. Somebody told me once, when you have the choice to move or don't move, move. So I never take the people mover thing at the airport because I always remember that advice. I want to tell you guys a little bit of the history of this event. I went to see Billy Case, physical therapist, when I had frozen shoulder, a common shoulder ailment that people over 50 get. and Billy and I got to talking about this passion he has for falling and preventing seniors from falling. And we decided it would be a great idea to bring a falls prevention awareness program to City Hall to kind of elevate the discussion. Most people don't know how many seniors really are affected by falling. So Billy, if you could talk a little bit about the numbers, a little bit about the stats.
Okay. It's actually reported through the National Council on Aging. 1 out of every 4 older adults over 65 years of age will fall each year. Every 11 seconds, an older adult is treated in the emergency room from a fall, and every 19 minutes, an older adult dies from a fall. So a growing number of older adults fear falling, and as a result, they limit their activities and their social engagements.
Tell me a little bit about how COVID-19 is affecting this topic.
Well, COVID-19, as we all know, does affect many people that have an immune deficient system, which many times can fall in the elderly or older adult population. So consequently, they've been staying home, and people have had to kind of come visit them from the outside, and they've not really been able to get out socially, they've not been able to get out socially, which also has affected their physical being as well. So consequently, being able to the inability to be able to exercise has really hampered their ability to stay active, independent, and strong, and therefore daily exercises is vital for everyone, but especially for the older population, and that's kind of my belief system, and really trying to keep them exercise each and every day. And they can do a lot of things at home, which work perfectly well.
Great. And that is COVID-19 is obviously why we're doing a virtual program this year. When I was working for Councilmember Costello for 5 years, we had an actual event, a live event, and brought in seniors from all over the city and different organizations that gave demonstrations and talks on how seniors can prevent falling. So this year we're going virtual, and that's okay. We hope this gets out to a lot of people via HTV and social media and other ways. And in addition to having Bill Case, who'll be doing a demonstration later in the program with my own mother, teaching her some exercises, we'll also be hearing from Deborah Moore and Paula Johnson from the Harris County Area Agency on Aging, and also from Chandra Weigel, who is with the AARP. So Billy, let's get going. Let's get this program started.
Great, looking forward to it. Thank you very much. I look forward to have a great week.
Hey little honey, I've got
everyone. everyone. Welcome back. Right now, I'm joined by Deborah Moore from the Harris County Area Agency on Aging. Deborah, it's so good to see you again. How are you doing?
I'm doing great, Sallie, and thank you so much. Just very, very busy.
Well,
How are you?
I'm sure everyone at the health department is extremely busy right now. For everyone watching, Deborah Moore is the Assistant Director for Human Services for the Harris County Area Agency on Aging. This is a city department, even though it's called Harris County Area on Aging. And I wonder, Deborah, if you could tell the audience a little bit more about Harris County Area Agency on Aging, or AAA, and what you do.
Absolutely. The Harris County Area Agency on Aging is part of a nationwide federal program which was authorized by the Older Americans Act in 1965. The Harris County Area Agency on Aging, or AAA, as we so fondly call it, is a city-county partnership, and it's housed at the Houston Health Department. Our mission is to help older adults stay safe, healthy, and well while remaining in their homes and communities.
And this work is so important, and I'm so grateful for everything you do for the seniors in the greater Houston area. What services do you offer as an agency?
We provide information, referral, and assistance services. We provide benefit counseling, which at this time is very important as we're moving into the open enrollment period for Medicare. We provide case management services, personal assistance and provider services, visiting for older adults, which is also a very important service to prevent social isolation. We provide caregiver support services, the non-emergency medical transportation, and as I mentioned earlier, home-delivered meals for homebound older adults, but we also provide congregate meals to ensure socialization. Other services that we provide are emergency response services, residential repair, health maintenance services, which include vision, dental, and hearing assistance. We assist older adults in purchasing prescription medication, mental health counseling. We also help older adults remain strong and active by offering evidence-based programs that keep them healthy. Some of the programs that we offer are Tai Chi, arthritis management, A Matter of Balance, which is a falls prevention program. And these programs promote health and prevent disease. Now, while we have a wait list for some of these services, older adults and their caregivers can call our intake number, which is 832-393-4301, and request additional information about how to access our service.
That's wonderful. And it is just amazing how many important services Harris County Area Agency on Aging provides. And thank you so much for what you're doing. And tell me about how things have changed since the onset of COVID-19.
Yes, definitely. We've experienced some changes during this time of COVID-19 and the concern for the well-being of older adults. Per CDC, older adults are at greater risk for hospitalization and death due to COVID-19. We're strongly encouraging our seniors to limit out-of-home activity to essential visits only. As a result of that, we recognize that older adults are staying at home much more now than they ever have. So we're assuring that we bring services to them to assist them to maintain their health and their well-being. We're ensuring that home-delivered meals are available, that home-delivered prescription assistance is available to older adults, as well as utility assistance, income support, and for older adults that are in need of cooling their homes, we provide portable air conditioning units.
That's great. And now I'd like you to get into the topic of this program, which is falls prevention. I know you and I have worked together in the past, and we've had very successful events, in-person events on falls prevention awareness. So tell me how Harris County Area Agency on Aging is involved in falls prevention.
So we do work to help older adults stay safe and assist them to stay healthy while they're at home. Again, we do recognize now that older adults are staying at home much more. And again, according to the CDC, over 3 million older adults are treated in emergency departments each year for falls. And that in every 20 minutes, an older adult dies from a fall. With these statistics, we knew we had to do something to help them stay in their homes and stay safe in their homes.
Right. And when you hear those numbers, and I just know anecdotally hearing from friends whose parents or grandparents, it always seems to start whatever kind of their, ultimately, if they end up dying, sometimes it starts with a fall. The fall is the first thing that happens, and then things can deteriorate. So if we can do all we can to prevent falls and prevent that kind of decline that happens after a fall, then we've done a good service.
Yes.
What are steps that we can take to prevent falls?
Yeah, so that's the thing, Sallie. Falls do not have to be a natural part of aging. There are many steps that we can take to prevent falls. While falls may occur anywhere, we recognize that most of them do occur in the home. So there are tips that we offer to our older adults in our community to help them stay safe in their homes. And some of those tips are, first, clear your home. Remove clutter, small furniture, pet gear, electrical cords, throw rugs, and anything else that might cause someone to fall. Secondly, arrange or remove furniture so that there is plenty of room for walking around your home. Next, you can put essential items where they're easy to reach, and add grab bars inside and outside of your bathtub or shower and next to the toilet. Put railings on both sides of the stairs and make sure stairs and hallways always have good lighting. Make sure outdoor areas are well lit and walkways are smooth and free of puddles and ice. Now, we don't have much ice in Houston, but again, let's be sure that if we do have ice, we clear it out. Use a cane or a walker if necessary. And know where your pet is at all times. That's very important because I've heard often about older adults, and we do love our pets, but the pet is there and we may not know and we'll trip and fall. So don't let your cat or dog trip you. Keep a flashlight near your bed in case your power goes out. Please don't stand on a table or a chair to reach something that is too high. Use a reach stick. And if you do stand on a step stool, please ensure that someone is standing next to you. Keep all emergency numbers in large print near you. And if you have a fear of falling or need help fall-proofing your home, call us. Call the Area Agency on Aging at 832-393-4301 for assistance. So again, if you have a fear of falling, if you need help fall-proofing your home, I want to give that number again. The number is 832-393-4301. And Sallie, if I may, I'd like to end with this quote from one of my sheroes, Eleanor Roosevelt, who said, "Beautiful young people are accidents of nature, but beautiful old people are works of art."
Deborah, thank you so much for providing these very important tips. I really appreciate your helping me elevate this issue. We know that car crashes are preventable. We also know that falls are preventable. We don't want to see them as accidents. We want to see them as preventable. So I appreciate your helping me get the word out on how seniors can make sure they don't fall. It's always great to see you, Deborah. You've been wonderful through the years on this issue. And let's move on to speak with Chandra from the AARP.
Thank you.
Let's blow it all. Come on.
Welcome, Chandra Weigel. I'm so fortunate to be joined now by Chandra Weigel from AARP. Chandra, why don't you introduce yourself?
Thank you, Councilmember Alcorn. My name is Chandra Weigel. I am the Associate State Director of Outreach and Advocacy here in the Houston area. And I am so happy to be joined with the council member to talk about some of the activities and information that we have at AARP.
We are very happy to have you, and we are excited to hear more about AARP's resources and services during this time.
I've actually put together a presentation, and we can go ahead and start with slide 1. For those of you who are kind of new with AARP, we are a nonprofit, nonpartisan member organization dedicated to advocating on behalf of the 50 plus. And since the COVID-19 outbreak, AARP Texas has brought our opportunities and information to our members and friends through our virtual events, teletown halls, and other information. Not only are there programs for unpaid family caregivers, but there are also presentations for people to avoid being victims of fraud. We have fitness seminars, cooking demos, workshops. And along with that, we are at the local level, we are advocating and working with our city leaders to ensure that Houston becomes even more an age-friendly community. You can learn more about our local offerings at aarp.org/Houston, or you can check us out on Facebook at AARP Texas and just look for our Facebook page. A little bit about the advocacy part of what we do at the national level. So here in Texas and across the country, AARP has been working with our governors, state legislators, and community leaders to take the necessary steps to support the over 40 million family caregivers that we have. And right now, AARP is fighting to protect nursing home residents and staff against sickness and neglect, isolation during this COVID pandemic, while also educating family caregivers on how they can advocate on behalf of their loved ones. So as we move to slide 2, what I've done here is gone through and isolated some information here that I think would be important for Houstonians. And this slide is actually information from our national, which you can share with anybody in the country. So remember, for more information about the coronavirus, you can visit our page, aarp.org/coronavirus. So moving into slide 3, here we have the AARP Community Connection, which is a portal that was created and launched to help combat social isolationism among older adults during this global pandemic. So if you know of anyone who's interested in receiving a call, visit the webpage or call the number that is provided. If you are interested in becoming a volunteer with the AARP Community Connection, then you can find that information as well on the AARP Community Connections website that has been provided for you. We have also provided other helpful information and activities, learning opportunities, and membership information. So if you have any questions about those, I've provided the numbers on slide 3 for your convenience. And finally, I want to again thank Councilmember Sallie Alcorn for the invitation to participate, and for those of you who are tuning in. Again, if you want more information about the local activities here in Houston, visit us at aarp.org/Houston, or you can find us on Facebook at AARP Texas. Please remember to mask up and stay safe.
Chandra, thank you so much for all of this great information. AARP is such an incredible resource for our seniors in Houston, and I thank you for all the great work you are doing. And thanks for focusing on what AARP is doing during the COVID pandemic. I hope that people will reach out to you. You've outlined a bunch of great programs. We've been talking a lot about falls prevention, people staying in their homes during this time and things they can do to not fall. But there's all kinds of other resources that can help seniors, especially during this time of the COVID-19 global pandemic. So I appreciate your being here with us today. Thank you for everything you do and everything AARP does, and look forward to seeing you again soon.
Thank you again, Council Member.
Hey, little honey, I've got the money. Let's blow it all.
Welcome, Paula. Right now we are being joined by Paula Johnson. She works for the Harris County Area Agency on Aging. And Paula, we just heard from your fearless leader, Deborah Moore.
Well, thank you so much, Sallie, for having me. Yeah, she's just wonderful, isn't she?
Deborah is great. She gave us a great introduction to what the Harris County Area Agency on Aging does. She provided us with some resources and gave us some great safety tips on how to prevent falls.
That's perfect, because my presentation is going to focus on those additional steps that you can take to help prevent falling.
Sounds great. First, would you like to introduce yourself? Tell us a little bit about how you got involved with this.
Sure. So I'm actually a 27-year Army veteran. I started here with the Houston Health Department in 2011, and in 2013 I came on over I saw the light and came to the Harris County Area Agency on Aging. And actually in 2017, I assumed the role as the Bureau Chief for the Harris County Area Agency on Aging. And so I'm responsible for all of the day-to-day operations. And I can say I've had the great pleasure of working with you on the Fall Prevention Program in the past. I'm very excited about this year's program.
Great, Paula. And first of all, let me say thank you for your service to our country. And we're so glad that you're here at the City of Houston doing such important work. I'll let you get started on your presentation.
So Sallie, as you are aware, that 1 in 4 older adults accidentally fall and harm themselves. And the proportion of the United States that are at risk for falls is projected to grow at least 30% by 2030. And many of these falls are caused by adverse effects from medications such as dizziness, confusion, dehydration, sedation, and other alternate reaction times.
Yes, I'm aware of those details from my work on this issue in the past, and it's really awful just how many seniors are affected.
I know. I mean, people are very unaware of how many older adults fall each year, and those falls are largely preventable. And so there are many resources that are out there for older adults, and some of those I'd like to provide with you are some of those prevention tips as well, for example. And so the CDC actually has an initiative that is called STEADY RX, and it's a collaboration between STEADY, which stands for Stop Elderly Accidents, Deaths, and Injuries, with their healthcare providers and pharmacists. And so these tips help provide guidance to pharmacists and physicians on how to screen pharmacy patients, how to access their medications, and intervene to reduce risk.
Well, I can certainly see how these kind of partnerships are critical, since many adults take medications for things like pain and sleep disorders and anxiety and high blood pressure. How does this partnership collaborate to prevent falls?
So the STEADY RX initiative says that healthcare providers should screen their patients for fall risk at the pharmacy. They should perform a medication review and share information with the patient and provider, and then the provider should share that information with their patients. They also have resources that will help pharmacists engage the patients and providers to improve fall-related health risks and issues, as well as tools for pharmacists on how to screen, on how to access, and coordinate care to help reduce older adult fall risk. And the recommendation is definitely go to www.cdc.gov for more information.
And also, don't forget to talk to your doctor about specific ways you can prevent falls.
So I'd like to share a couple of things with you that older adults can talk to their patients about. And one of those is talk with your healthcare provider about medications that may place you at fall for a risk. Also, exercise. Exercise is huge. Exercise to help improve your balance and your strength. Also, make sure you have your eyes checked, and then make sure you make your home safer. And so going in and looking for those things that can do falls as slips and trips that we know that need to happen. Remove small throw rugs or use double-sided tape to help keep the rugs from slipping. Also use those non-slip mats in the bathtub and on shower floors. And also wear well-fitting shoes with good support inside and outside the house.
That is so great. Those are really super important resources. And next, we're going to hear from Bill Case, a licensed physical therapist who's going to walk us through some balancing exercises and some additional tips to prevent falls. Paula, I can't thank you enough for joining me here today. And thank you for the important work you're doing over at the city's health department.
Anytime, Sallie. Thank you for having me.
Hey, little honey, I've got the money, let's blow it all. Come on, my baby, no if, buts, or maybes.
Hi, everybody. Thanks for sticking with us. Right now, I'd like to introduce an extremely special guest. This is my mom, Rosemary Comstock, and she's going to demonstrate some exercises and talk to Bill Case about certain things she can do to prevent her from falling. So take it away, Bill and my mom.
Hi, Bill.
Hi, Rosemary. How are you doing? How you feel today?
Good to see you.
Good to see you too. I wanted to start off and just kind of ask you and learn a little bit about what you do each day with your exercises. What's your kind of normal routine?
My normal routine, I get up in the morning and I walk for about a half an hour, and that's about it. I'm hoping you'll show me some exercises to help my balance.
Well, that's excellent. That's exactly what you should be doing, is walking each morning, 15, 20 minutes, perfect. And then to try to incorporate about 10 minutes of some exercises during the day. And that's what we're going to go over, some simple exercises that you can do. But first, I'd like to watch you walk with your walker just to see how you get around and just kind of check out your posture and how you pick your feet up and your balance and how you feel about what you're doing, and see if you have any questions, okay?
Okay, so I'll
there you go. Okay, now turn sideways for me and kind of like walk towards the other side of the room.
You say walk, with my back to you?
Okay.
Like that?
That's right. Just make sure you pick up your knees, and that'll clear your feet. That's what most people fall because their feet catch on something, but as long as you pick up your knees, you're good to go. And that looks perfect. Okay, come on back.
Okay, now come back.
There you go. Now stop right there, Rosemary. Stop right there. I want to make a comment. I want to tell you that the walker is really in the proper position for you. Your elbows have a slight bend in them, which helps you stand up straight, which you're doing a really good job as you're walking around. You're keeping your head up, shoulders back, keeping your hands firmly on the bars, and then you're picking up your knees when you walk. A lot of people think about picking up their feet. Sometimes they have some sensory problems. They don't really know where their feet are or can't find them. So by picking up your knees, you'll be sure to clear the floor so you won't trip. So what you're doing there, your posture and how you walk around is perfect. So just want to let you know that you're in good shape to walk, and hopefully you don't have any problems. So Rosemary, we're going to go over an exercise called the chair sit, where you sit down and then you stand back up to kind of work on strengthening up your balance, your posture, and most importantly, your legs to help you, get out of the chair and move around during the day, okay?
Okay, you want me to stand up and move around?
And what I want you to do to stand up for this exercise, I want you to scoot out at the edge of the chair just a little bit so you're not sitting at the far back of the chair, please.
Oh, okay.
Scoot out a little bit, then you're doing good. Yeah, just scoot on out. Then you can use your hands to hold on to the armrels and just stand on up. Nice. And once you stand up, what I'd like for you to do is make sure that your shoulders are back and your head's up. So before you start to take a step, you'll be balanced. So I'm gonna have you sit back down. Sit back down. We'll do it again. Do you have any pain when you do that, Rosemary? Any pain in your knees or your back or your ankles? Anything bother
I
you?
have a tiny bit, not much,
Where?
but not, well, I guess not really. So
Okay.
I can hear my knees clacking.
Okay, well, that kind of goes with the territory. I understand that. So this particular movement, getting up and down from the chair, is actually an exercise, which you could do, or one can do about 3 times, about 3 repetitions, but you could do it several times a day, even if you're not going anywhere, just as an exercise to strengthen your legs. So once again, let's try it again. You can hold on to the side of the chair, but I want you to slide off the chair a little bit, scoot your bottom out a little bit towards the edge of the chair, which makes it a little bit easier to stand.
Okay.
There you go. Lean forward and stand up. And then just, good. So either shoulders back and your head's up, and then just now sit back down. Beautiful. And what I notice is that you're lowering yourself down. Very important. Many times people walk up the chair and they just fall in the chair. So what you're doing, you're making sure you're safe. Your legs are backed up to the chair. You're holding onto the armrest and you're slowly lowering yourself. And that's good. That's perfect. That's the best way to do that. So do you have any questions about that?
No, I don't. Can't think of anything.
All right, great. Okay, so Rosemary, this next exercise we're going to do it's called a side leg raise. And so as you're standing there straight, using your hands to hold the back of the chair for support and balance, that's great. I want you to, while you're standing there, bring your left leg out to the side about 6 inches. Just bring it out to the side and hold it for about a count of 5. 1, 2, 3, 4, 5, and back down slowly. And just kind of relax there. Bring it up again. 1, 2, 3, 4, 5, back down slowly. And then just stand up, keep standing up straight, just like that. And all you would need to do is do 5 times to the left side, then you do 5 times to the right side, and hold for about 5 counts. As it becomes easy, you can increase the numbers up to, say, 10 times. But the important part of this exercise is that you're holding onto the chair, you're keeping your back straight, you slowly bring your leg out about 6 or 8 inches to the side. That keeps you from hiking your hips or using your back. So it's a real safe exercise, and this exercise helps strengthen your legs and your hips to help with walking and balance for when you get around during the day. Any pain with that? Any questions?
No,
Okay.
just 6
Right.
inches.
About 6 inches out to the side. That's perfect. Hold for about a count of 5, down slowly, and then just relax. Make sure you kind of stop each time, put both feet firmly on the ground, and then bring it up again. And you'll do that 5 times. That lets you have a chance to recover, relax, make sure you're nice and steady each time you pick it up. And then you do the left leg 5 times, then the right leg 5 times, and hold for about 5 counts when you get it out to the side.
Good, okay.
All right, very good. So what we're gonna do the hip bending or single leg stand. So what I'd like for you to do, it doesn't matter which leg you pick up, but pick up one leg about 1 or 2 inches off the floor for me. Just raise it up. Actually, you can come up a little higher. I said 1 or 2 inches. Just raise your leg up and hold it there. On the leg you're standing on, slightly bend the knee just a little bit.
What do you say?
Slightly bend the right knee that you're standing on. There you go. Hold that. That's perfect. And so I'm gonna hold it for a count of 5. 1, 2, 3, 4, 5, and let it all the way down. And then switch legs. Bring that right knee up in the air. Kind of flex your hip up. There you go, and hold that. Keep your back straight. There you go. Keep good firm hold on the chair. Keep your back straight. And you can be as close to the chair or far away from the chair, wherever you feel comfortable, okay? So just pick that right knee up, your hip up. You're going to hold for a count of 5. 1, 2, 3, 4, 5. Let it down. And switch again to the other leg. It gives you a little rest between each lift. Pick up the left leg. There you go. Perfect. Beautiful, Rosemary. 1, 2, 3, 4, 5, and then let it go slowly. So what I'm pointing out as you do that, by raising your leg up, that helps you with walking, because it makes sure that you pick up your legs, which makes your feet clear the ground. You're standing perfectly straight, you're well balanced, and you're holding onto the chair for support. Does that feel okay? Do you have any questions about that?
No,
And that exercise you could do 5 times to each leg and hold for 5 counts. And then when you're through, just move on to the next exercise, because that's a very good technique which you're performing there.
Okay.
All right. Now, the next exercise would be, now you can just turn to your right and put both hands on top of the chair. There you go, perfect. So as you're standing up nice and straight, your head up, shoulders back, and then raise up on your tiptoes. These are called heel raises. Raise up on your tiptoes. Kind of pick your heels up as you go straight up in the air, and hold it. 1, 2, 3, 4, 5, and down. Hold it, and then down. Perfect. And go down, and raise up. 1, 2, 3, 4, 5, and down. And raise up. One more time. 1, 2, 3, 4, 5, and down. And Rosemary, you can do these 10 times, 15 times. Really, this is a pretty easy exercise, but the importance of this exercise, it helps you with maintaining your back nice and straight. But when you walk, you want your calf muscles strong to push you off so you can pick up your knees and take that next step. And as you look straight ahead while you're doing this exercise, that'll help you when you walk, so you don't feel like you need to look at the ground, because you're doing an exercise while you're looking straight ahead. And it feels pretty confident, it feels pretty secure, doesn't it?
Yes.
Yeah, that's perfect. So those 4 exercises take about 10 minutes to do, maybe. But there's other exercises you could add or do or interject. You don't always have to do the same exercises, but 10 minutes of anything is going to make you feel a little bit more active, help your blood circulate, help you with your posture. So 10 minutes of exercise followed with your 15 or 20 minutes of walking is all a person needs to do each day, just to kind of stay active and hopefully independent and moving around.
Hey, I'm going to write these down so I won't forget. Sallie can help me.
We are for sure going to write these down and give her some great pictures to go by. Billy, thank you so much. You know my mother, and you've always been so kind to her. And these are going to be exercises and tips that I know are going to help her live a grateful life without fear of falling. So thank you very much. And now we are going to head to the Mayor's proclamation on falls prevention awareness.
Thank you, Billy.
Thank you.
Hello, I'm Mayor Sylvester Turner. Thank you for tuning into our Falls Prevention Awareness program. The program is meant to build awareness around falls prevention, present resources, and provide you with proactive measures and balancing techniques to ensure your safety. Many do not know that falls are the leading cause of both fatal and non-fatal injuries among older adults in the United States. Injuries from falls can lead to depression, loss of mobility, and loss of functional independence. Unfortunately, the financial toll for older adults' falls will continue to increase as our population ages. This problem is especially relevant with many older adults staying home during this pandemic. So I ask you to stay home, stay safe, and stay active. This is an issue important to all Houstonians, and I want to thank Council Member Sallie Alcorn, AARP, the Harris County Area Agency on Aging, and the physical therapists and other experts who contributed to this show. Now, this is when I get to say, therefore I, Mayor Turner, do hereby proclaim September 22nd as Falls Prevention Awareness Day in the city of Houston.